Hello everyone, my name is Stacy Lavilla and I'm the Director of Communications here at the Association of Asian Pacific Community Health Organizations, APCHO. On behalf of APCHO, I wanted to thank you for joining us for today's webinar entitled Integrating Voter Registration into CHC Operations. We're excited to present you with today's webinar on how voter engagement programs can be integrated into a health center's day-to-day operations. Joining us as your presenters today are Jeffrey Caballero, the Executive Director of APCHO, and Mark Weatherhorn, the Project Director of Community Health Voice. Before we get started, I wanted to review a few housekeeping items and let you know how you can participate in today's webinar. If you take a look at your screen, here we are looking at an example of the GoToWebinar attendee interface, which is essentially made up of two parts. There's the viewer window shown here on the right, but it may be on the left on your screen depending on your browser or your computer operating system. And this allows you to see everything that the presenter will share on their screen. The control panel, shown here on the left, may be on the right of your screen, and this allows you to participate in this webinar. Please note that all attendees are in listen-only mode and will be muted during the presentation. By clicking the orange arrow button, you can hide or show your control panel. You can also set the control panel to auto-hide or not to auto-hide by going to the View menu. After the presentation, we'll be holding a Q&A session. To participate, you can click the blue Raise Hand button shown here on your control panel. Alternatively, you may also submit questions in writing during the presentation by typing them in the questions field. We will be reviewing them as they come in and will address them during the Q&A session. Today's webinar is being recorded, and you will receive an email with a link to view a recording of today's presentation after the webinar. And with that, I will hand it over to our first speaker, Jeff Caballero.
Good afternoon, everybody, or good morning to some of you out in the Pacific. Thank you for joining us for today's webinar. As you know, the second round of ACA outreach and enrollment is set to begin on November 15th. And preparation for this period is occurring while many health centers are still in the thick of registering or have just registered a number of their community members to vote. We hope that this webinar will be helpful to you as you are thinking of how to further integrate voter registrations into the health center's day-to-day activities. This is the second of the two webinars in this civic engagement series. I hope that some of you participated in the first one, which you can still find on our APCHO website. But this particular webinar for APCHO members will be most helpful to frontline staff that will be directly engaging with patients and integrating voter registration into your health center marketplace coverage enrollment processes. At least we believe that it will provide you with some insights to better facilitate that integration. I want to introduce, I will let Stacy actually introduce Mark in this next session.
Thanks, Jeff. We are happy to have Mark Weatherhorn with us today as our first presenter. Mark has over 30 years of political organizing and advocacy leadership experience at the state and national levels. He started Mark Weatherhorn Consulting to assist nonprofit organizations, trade associations, and businesses in creating the organizational culture, strategies, and structures needed to win meaningful public policy victories. Prior to starting Mark Weatherhorn Consulting, Mark served for 15 years as the National Advocacy Director and Senior Director of Advocacy and Civic Engagement for the National Association of Community Health Centers. At NAC, Mark built a recruiting, training, and support structure for a national network, which today serves over 70,000 grassroots health center advocates in all 50 states. He also initiated and managed NAC's Community Health Vote civic engagement program at health centers around the country. And so with that introduction, I will let Mark take it away.
Thanks, Stacy. Thanks, Jeff. Thank you all for being on the call today. I know that some of you are thinking, well, the election's a couple of weeks away. What are we doing? And I think, as Jeff said, what we're trying to do is help you think through how to integrate this activity into your ongoing activities at your health center. And I'm going to talk a little bit about that. I'm going to address the enrollment process, or how this fits into the ACA enrollment process, and then Jeff is going to walk you through a new and really nice tool that APCHO has set up to help you in this. Some of you, I think if I looked at the registration list, I've done this presentation maybe for a couple of you before, and what I hope is, as Stacy said, that you will take this, and I'm certain we can make, it'll be recorded, we can make the presentation available. I'll be available for assistance with your frontline folks who are really going to be involved in making this happen. So next slide, Stacy. So I think it's really important when we talk about doing this, because I think we're fully aware that this is another activity that we're asking you and the folks at your health center to do. You have to really understand why it matters. And so I always make sure that folks understand that when you look at the revenue of the average health center, in essence, your biggest customer is the government at one level or another, which means you have to take care of them, and they are really made up of elected officials. Over 80% of a health center's revenue comes from the government, whether it's Medicare, Medicaid, your federal grants, state grants, or other contracts. It's really, you know, they are your largest customer. Stacy, next slide. Or Beverly, sorry. I just want to make sure, hopefully all of you are aware of this, because as Jeff said, we built a pretty robust advocacy network at NAC. But many of your health centers received funding and are received funding under the Affordable Care Act from a fund that was created in the legislation to help health centers expand, with the idea that they were going to actually be able to take care of all these newly insured people. The only problem with that is when they wrote the act, they assumed that after 5 years, health centers would be seeing huge bumps in revenue from more patients, from more paying patients. And so this funding actually ends in 2016. And if Congress doesn't act, there's going to be a 70% cut in the grant funding to health centers. You can look for yourselves and imagine what a 70% cut in your grant would do to your health center and your services. But the point here is these are, again, elected officials who have to act in order to protect health centers and their patients. Next slide. So the goals of the program that Jeff is talking about, I think it's really important that people understand this is not a voter registration drive. It's not a voter registration project. Our goals go well beyond just registering voters. We want to register every eligible voter who is a patient, a staff member, or a board member of a health center. We want to get every one of those people who are eligible that we registered to actually vote. Right? And after they vote, we want to engage our clients and patients in advocating for themselves, their family, and their community. Because once you elect folks, you have to be involved in the decisions they make. You have to hold them accountable. And we want folks in the AAPI community to do that. Next slide. I put this in here just because I want people to understand what they can and can't do with their health centers. If you look down the left-hand side, you will see all the things you can do, right? If you look down the right-hand side, you'll see the things you can't. And in essence, the things you can't do are engage in any sort of partisan political activity. You can't endorse a candidate. You can't give resources to candidates or a political party. You can't rate candidates only on your health center issue, and you can't tell people who to vote for. Anything you do that is completely nonpartisan, you can do at your health center. So people often ask, well, can we register voters? Yes, but you have to be nonpartisan. Can we educate voters about how and where to go vote? Yes, you can. Can you educate voters on the issues? Yes, you can. You just can't do it in a way that's partisan, that shows any kind of favoritism to one candidate or the other. So You know, that's part of what we're here to help you do, to make sure that you understand the rules and you don't violate them. But really, as long as you ask yourself, is anything we're doing, could it be perceived as helping one candidate or one party? If the answer to that is no, then you can do all of these things. Next slide. So I'm going to talk a little bit about why we do this, in part because my experience is that if you and your frontline folks don't understand why this matters, no matter how many resources you get, no matter how much the leadership tells you to do it or tells them to do it, they're not going to be as effective as if they actually understand why this makes a difference. Next slide. So if you look at all these items, elected officials and voting impact your clients and you and your health center on way more than just healthcare. Jobs, taxes, immigration, education, transportation. At every level of government, the decisions that elected officials make can affect all of those things for your health center, your community, and your clients. And so it's important to understand that this is not just about your health center. It's not just about healthcare. It's about empowering patients and empowering your community to make a difference on all these things that affect them, which is why we hope you will, and we will encourage you to work with community partners who have expertise on these issues beyond just healthcare. Next slide. Now, why should you do it? Health centers really have the potential to be extraordinarily unique and extraordinarily effective in this work, right? It matters to the future of your health centers and your patients. The populations least likely to vote are your patients already. You can have a tremendous impact on them because they trust you, right? If you offer them voter registration, or you tell them they should vote or remind them about the election, it makes so much more of a difference than somebody knocking on their door, some stranger calling them, somebody stopping them on the street or in a mall. Health centers are in a unique position to be very effective and to really have an impact. Next slide. And we know this because we've done this before. As Stacy told you, we started Community Health Vote really at NAC when I was at NAC in 2008. In 2012, we really tried to ramp this project up so that not only did we register voters, we reminded them to vote, and then we tracked whether or not they actually voted. And what we found is that absolutely, in the places where we did this, we saw an 11% increase in the turnout of the patients that we registered or contacted in 2012. Next slide. Most importantly for all of you, if you look at this voter turnout by race or ethnicity, and you look at the Asian and other turnout on the far left, what you see is, again, all we did was register people or ask them if they wanted follow-up to remind them or to help them know how to cast their ballot. And what we found is that, again, in the Asian community, we increased turnout, and this is in a presidential year. Its turnout is much lower this year, you know, in a midterm election. But in a presidential year, we were able to increase turnout by 11%. And if you look at the other columns, you'll see that in every racial category, if we did this at a health center, it made a huge difference, especially in the Hispanic community, where the difference was really 20%. Next slide. Same thing when you look at income. Again, lower income people are almost certainly, you know, more likely not to vote. If health centers encouraged them to vote, they were, again, almost 20% more likely to turn out. And when you think of the fact that health centers have 23 million patients, the potential is enormous. If you think at the number of patients you have at your health centers, the potential is enormous if we do this and we do it well. Next slide. So here's where we're going to go into the best practices. Now, as I said, we really started this in 2008. We've done it for a while, really beginning in 2012. We wanted to integrate this into the enrollment process for the ACA, but as I'm sure everybody on the phone knows, the rollout of the ACA didn't exactly lend itself to efficiently integrating voter registration or anything else, but we did begin to do this in a number of places after the first of the year. And what we found is the #1 best practice, no matter what the requirements are for your state or your government or your local registrar, is to view voter registration as just another service your health center provides your patients and your community. Just like you provide health care, just like you provide advice on healthy living, just like you provide workshops on smoking cessation, registering people to vote and helping them vote is another service every health center should provide. And to do that, you have to integrate it into your health center's ongoing activities. You don't do it as some add-on activity that you just give somebody to do because you think they have time to do it. Next slide. So where's the best place to do it in your center? Depends on your health center. As everybody who's ever seen me speak knows, I believe when you've seen one health center, you've seen one health center. We have probably 12, 13 health centers on the phone today. Every one of your health centers is different. But you can do it at intake, at the front desk. You can do it while folks are sitting in the waiting room. This says you can do it after coverage enrollment. I'll talk a little bit about that in a minute. You can do it when folks check out. You can do it at events. And you can do it at all of those places. Every one of those interactions with patients is a place where you can do it if it works at your health center. Next slide. What we know is this, is that one-on-one interactions always work best, right? Putting a table with voter registration forms out in your waiting room or just handing people a piece of paper without explaining to them or asking them doesn't really work very well. Putting a computer in your lobby where people can register online doesn't work unless somebody asks folks, right? So where are the best interactions in a health center? Certainly the best is coverage enrollment, when they're enrolling in Medicaid or the marketplace or any other service that you provide. Right? The next is when folks are getting their sliding fee determination. They're sitting there one-on-one with somebody, they're going through a process. That's a good place to ask. Even the pharmacy window, when people come up to hand in their prescriptions or to pick up their prescriptions, asking them if they want to register to vote. And one of the great advantages, especially now, is using outreach workers as you go to voter registration assisters, whether they're in the health center or they're working out in the community. These are people who interact with folks on a one-on-one basis all the time. That's their job. They already do this about other things. They can do it about voter registration. Next slide. Somebody has to ask. Again, wherever you're doing it, somebody has to ask. And one thing I will say, when we talk about asking in the waiting room, just having strangers wander around the waiting room asking people if they want to register to vote is not always the best way to do it. Next slide. How you ask matters. The single most important determinant of whether somebody will actually say yes, which is what we want them to do, is how the person asks them if they'd like to register to vote, right? Registration assistance is just another service the center provides its patients in the community. We want folks to talk to the patients like that. Right? Visibility matters. Posters everywhere. One of the best places is the back of the exam room door. Buttons that say "Ask me about registering to vote" on all the staff, not just the people who are registering voters, but all the staff, so that if they ask them, everybody on the staff knows who to direct you to, right? You can hand somebody an information form with their check-in documents that asks them if they'd like to register to vote. But you don't want a patient to walk in or a client to walk in and sit down and not know that voter registration is offered and have somebody ask them if they want to register to vote, because in many cases they will look at you and go, well, why are you asking me that? Right? It will be a surprise. People are less likely to say yes if you surprise them. And lastly, enthusiasm matters. And this goes back to what I said before. If the folks doing this don't really want to do it, if they don't think it's important, if they don't come across to the patient as making it sound like it's important, people will say no, right? It will just be another question, a million questions they get asked, and they say no. So really the training of the folks who are going to do this is incredibly important so that they know how to ask people about registering to vote so they get yes for an answer. Next slide. And this is just one of the things we have, and AppShow will have for you, are sample scripts of how to ask the question, how folks can ask the question. And again, if you do it before the enrollment process, it's simple. Before we get started, another service we offer our patients is helping you register to vote or update your registration. Your vote really matters to your health care and your health center. So I can help you quickly register to vote or update your registration right now. It'll only take a couple of minutes. Right? That's very different from saying to somebody, would you like to register to vote? We also want to make sure that they ask the question on your register to vote at your current address, because many people will say they're registered to vote, but if they've moved or their name is changed and they don't update their registration, they're going to have a problem when they go to actually vote on election day. The registration has to be up to date. Next slide. So if you're going to do this at intake, right, we have follow-up forms which I'll show you that you can give to every patient when they check in. And they can opt in to get reminders about voting or about advocating for their health center, or they can say, I want to register to vote. When they turn that in, they can be directed or a follow-up contact to register them to vote. Again, one of the great things is if you've got certified assisters or people who've been trained in the process we're going to talk to you about, they can be referred to them, and literally the process takes at most 5 minutes. You want to have staff who can answer questions so that everybody on the staff doesn't think they have to know everything about voting. And then during an election season, this doesn't really happen most of the time, but like right now at health centers that are doing voter registration or have been doing it, when somebody says they're already registered to vote, you want to ask them to pledge to vote so we can collect their contact information and then send them reminders or GOTV communications and follow up. Next slide. This is what one of the follow-up sheets I'm talking about looks like, and obviously we'll design your own and you'll need them in languages for your health center. But the goal here is just to, again, put something in front of patients so they know voting is important, that your health center supports it, and it gives us another vehicle for collecting information. Because you cannot use, as you all know, I hope, you can't use your patient files to communicate to people, your patient database, to communicate with anybody about anything other than their health care at the health center. So in order to communicate with them about voting, registering to vote, advocating for the health center, we have to have a separate database that allows us and that we have the permission to contact them through. That's part of why this process, parallel to registering people to vote, is very important, because building that list is what allows us to remember to achieve our goals of not just registering people, but getting them to vote. Next slide. I put this in here because a lot of health centers think that they can achieve the goals of engaging their patients by working with partners, by getting other people to come into their waiting room and register voters, or to come to their events and register voters. That's one way to do it. However, if you're going to work with partners, you really have to be careful. You don't want people hanging around the health center all the time. You want to use them during your peak hours. You want to make sure that they are actually nonpartisan, that they are not perceived as partisan. You know, even if they're a 501c3 like your health center, they can be perceived as partisan. We ran into this in 2012 because the organization Organizing for America went to some health centers and said they would like to register voters in their waiting rooms and told them that they were a 501c3. Well, Organizing for America is a 501c3, but it was actually the follow-up to Organizing for Obama. So that the perception of Organizing for America was that it had a partisan agenda, and it created some issues for some health centers. So you just have to be careful. You need to make sure that they're going to come in and be registering patients at your health center, that the volunteers are well trained, that they understand how to operate in a health center setting, they understand how to talk to health center patients. You just have to remember that that the value of your relationship with your patients and clients to get them to register to vote and to vote is the most important thing. You want to make sure if you've got other people doing this on behalf of your health center that they don't do anything to damage that relationship. Next slide. Waiting room best practices, again, I don't think it's particularly a good idea to just have people in the waiting room walking around talking to patients, asking them if they want to register to vote. You want to have a visible table. You want to have trained staff there. You want to have them engage the patients as they come in, and the front desk can refer people to the table. But you don't want to think of waiting room voter registration as something that looks like registering people at the mall. Right? You really just want to have it be another service, a place where there's another service provided to your patients. Next slide. Best practices at events. I'm not going to spend a lot of time on this. This is basically the same thing as in the waiting room. You really want to make sure that you've got well-trained people representing the health center, that you're very visible. Most important for doing this at events when you're outside the health center, if you're not doing this at a computer online, and we'll talk a little bit about that in a minute, somebody has to make sure you collect the completed voter registration forms. The rule of thumb is never register somebody at a health center or a health center event and let them walk out with the form. You have no idea whether it actually got turned in or what they did with it. You want to collect the forms. You want to ensure that they get turned into the registrar in a timely manner based on the law in your state. It is never a good idea or something you want to encourage for folks to say, even if they say, well, I don't have time to finish it right now, can I take it with me? You really are better off saying, well, it'll only take a couple of minutes. Let's go ahead and finish it right now, and then we can get it turned in for you, and we'll save you all that trouble and the cost of a stamp. It may require a little convincing, but it's really worth doing because it is not a good practice to let people take the form with them, say they'll fill it out later. A significant percentage of the time they never fill it out, they never mail it in, they never get registered. Next slide. Again, I put this in here to remind people that it's not just about voter registration. It's getting them to vote, and it's being able to engage them. So we need their information to do that. Next slide. So this is where we're really going to talk about, you folks are going to start open enrollment again on November the 15th, just a few weeks away. I just spent a week in California, where in California, their marketplace, Covered California, is actually now required under the law to offer not just voter registration, but the same level of assistance in registering to vote as they provide someone in enrolling in coverage. And so I've gone through this a few times, and we want to do it a little differently. Even the federal form, the federal marketplace, does have a place where the question, do you want to register to vote, is asked. It's there at the end of the application process. As you heard me say before, that's not the best time to do it. What we learned in doing this last year was, if you wait until somebody's already spent an hour filling out a form, even if you're in a state where Medicaid's been expanded and they're going to get coverage, but they have to wait to see what they get, after an hour of filling out a form or an hour and a half of filling out a form, asking them to fill out one more form, even if it only takes 5 minutes, no matter how well you ask, gets no for an answer way more than it gets yes. They just want to get out of there. So the best practice, and what we hope all of you will do as you think about the beginning of your enrollment process, is before you sit down with someone and start opening the application, that's when you want to ask them if they would like to register to vote. You know, before we get started, another service we provide that we think is really important is offering our patients the opportunity to register to vote or update their voter registration. We can take care of that right now before we get started. It'll only take a couple of minutes. Would you like to go ahead and do that? Right? And that's when you're going to have the most success doing this as part of the enrollment process. And the reason to do this as part of the enrollment process is because you've got people coming in, they're sitting down for that one-on-one interaction, and you're going to have that going on all the time. Even when it's not open enrollment in states that have expanded Medicaid, you've constantly got folks coming in. The assisters can be doing this for people who aren't coming in to enroll after the open enrollment period, but it's really important to think about doing it first and to ask the question in the right way. And one of the things we're going to go over here today is the folks at APCHO have worked with Rock to Vote to create a really neat online registration tool that allows you to register people to vote in a very simple, straightforward way in language, and allows us being APCHO, to capture their contact information so that we can send them GOTV reminders, and also, if they choose, follow-up information about being advocates or being engaged in issues for their health center. So this is a process where we think, while you can do it in all those other places that I mentioned to you, to start out, if you're not already doing this at your health center, this is really the best place to think about starting because it's a natural activity. Next slide. So just to sum up, because when I'm done, Jeff is going to go over that online voter registration tool for you. And it's really neat, especially in a community like the AAPI community. First is to have realistic goals and expectations. I was just at a health center in California, and one of the enrollment people who had been doing this was really frustrated. She said, oh, we started doing this, and it was really hard because I talked to 10 people, and out of those 10 people, 9 people said no. That's not a bad percentage to start out with. I can tell you that. If you get 10% of the patients that come into your health center who have not been registered to vote before to register, that's actually really good. The reason you want to do this over time is because they may say no the first time they come in. They may say no the second time they come in. The third time they come in, they may say yes, right? But if you only ask them once, if you only do it right before the election, if you only do it when maybe they're distracted, they may say no. If patients at health centers were easy to register to vote, they would all be registered already. So have reasonable expectations. Know the law. Make sure that everything is done in a nonpartisan way. In APCHO, we have myself and other consultants to help you do that if you ever have any questions. Enthusiasm matters. Recruit and train your staff to do this. Make sure they understand why it's important. If they just think it's just another job the health center's given them to add on to what they're already doing and they don't see any point in it, they're not going to be very good at it. And help us capture the data for voter education and GOTV activities. If you register somebody to vote, if you do it online, we capture the data automatically. If you do it on paper, depending on your state, you can copy the registration form and redact their social security number, and we can use that information. But it's really important that that allows us to follow up. It also allows us to see whether they actually voted. Next slide. So to sum up, these are the elements of doing this successfully at your health center. The whole organization has to be committed. You need some individual champions. I'm hoping you guys on the phone today are individual champions and are going to want to make this work at your health center. You need a plan for doing this. You can't just announce on November the 14th that now your enrollers are going to assist people in registering to vote and it's a really big deal. And then you got to know and remind everybody, your staff, your board, everybody, that you are making a difference, that this matters. Next slide. So this is my contact information. That's my direct phone number. I work out of a home office. You can reach me there. That's one of my email addresses. I'll get it. And I'm glad to help you or answer any questions that we don't get answered today. So I guess we're going to do questions at the end, and now I will turn it back over to Stacy and to Jeff.
Thank you, Mark. I am now going to turn the floor over to Jeff, who will be talking about APCHO's voter registration tool.
Thank you, Stacy, and thank you, Mark, again for the session that you just shared with us. Again, this is Jeff Calietto, and I'm the Executive Director at APCHO. I wanted to start off my piece of this presentation by just reiterating a couple of points that Mark had alluded to or actually shared in one of his slides during his presentation. What you see in your screen right now should be APCHO's web page with APCHO's voter registration tool. But before we do the click through of this, I just really wanted to emphasize the point that Mark made when he said that the goals of this program is not just a voter registration drive. It is to register every eligible voter, to get every eligible voter to vote, and to engage clients in advocating for themselves, their families, and their community. And to do that, what APCHO has started with is the development of a voter registration tool to help us measure the impact that the health center is implementing and contributing to the civic engagement effort. And let me just start by saying that the reason that APCHO had developed a voter voter registration tool. It's a new acronym for me, so be patient with me, folks. Voter registration tool is that if you use the current state registrar's form or even existing Rock the Vote forms, your health center or APCHO will not be in a position to get a list of the individuals that you provided service to, and so we will not be able to evaluate what gets our clients to vote. So the voter registration tool that APCHO has developed is really a national tool that has been developed in partnership with Rock the Vote, so all of APCHO's members will have a consistent way to collect the necessary information needed to properly implement and evaluate the program that we hope to be implementing in community health centers across the country. So let me draw your attention to the voter registration tool. As Mark noted, this completion of the voter registration tool takes really 2 to 3 minutes maximum. And there are many time-saving benefits to using our tool compared to some of the other instruments that are out there, and I'll try to highlight that as we go through. But before I start, it is important for you when you are engaging our client that you indicate, as noted on the fine print on this website, that the decision that the client makes to register or not register will not affect the amount of assistance that will be provided to them by this organization. So it's very critical that your clients know that from the start. But as you will see from the beginning of this tool, we started off by listing a drop-down tool of APCHO's different websites, member organizations across the country. And just for the interest of convenience, Beverly, let's select Asian Health Services because of the Oakland zip code. And click Submit. So, the next page here asks if your client has an email address or not. This is one of the special features that APCHO's and Mark's Community Health Vote tool has that distinguishes it from the Rock the Vote and many other online registration tools. We've heard from many of our members, particularly after the first round of outreach and enrollment, that very few of our patients actually have email addresses that they utilize on a regular basis. Online tools in general requires an email address. Otherwise, you have no other choice but to use the paper forms to completing the registration, which doesn't help or facilitate our discussion. So we had asked Rock the Vote to modify their programming so that we can provide you with a tool that would work for your clientele. So let's go ahead and click no here, that there is no email address. And next window, ask us for zip code information as well as date of birth. And so for zip code, let's go ahead and enter 94613 or 12. That's our Oakland zip code, right? And then for date of birth, let's just make something up, 01/01/1965. And as you know, the buttons there that are followed are some of the requirements, but let's just say that that you are clicking that the client is a U.S. citizen, and that the client will be 18 years of age by the next election. Let's say that's just what you click. So go ahead and click through the next page. Oh, I'm sorry, I forgot to highlight. Let's go ahead and scroll to the top. And I just wanted to be able to feature. Keep going, Beverly. I wanted to show where the language was selected. All right, patience, folks. We have to start over here. All right, so you should be seeing the window now that allows you to choose one of 13 languages that the form exists in. And what you will see once you select one of those languages is that the questions on the screen will turn into that language. However, the entries will still have to be in English, otherwise the registrars will not be able to understand what was being submitted. But it should provide your enroller and the client an opportunity to see the screen together and answer it together as well. So let's go ahead and leave it for English for now and enter the zip code again, Beverly 01/01/1965. I am a U.S. citizen, and go on to the next screen. The next screen here, all you see is they're asked for the title of an individual. You have to select one of these, and then fill out the rest of the name. But for the purpose of this walkthrough, let's just enter text in all of those categories, Beverly. And Oakland there, Oakland City. And then you have to indicate in this box that you have to provide a home address to get your registration information. You are not allowed to submit a P.O. box for your voter registration information. You have to provide an address that you actually live at, and click one of these boxes. And go ahead and enter text in those categories as well. And the boxes that you see below here just indicates if this is a change of address or a change of name, and click those if those are appropriate. Otherwise, you can just leave them blank. What I wanted to note here is, before moving forward, is that there is a phone section on this information. This is specifically designed because from the outreach and enrollment efforts as well. Even though many of our customers, our clients don't have email addresses, many of them we were told does have cell phones that receive text. So our capacity in the future will have texting capacity. So if a client of yours wishes to receive information from you, either through email or through text, then we request that you would get their information and enter it in this area. Next step. Okay, at this point, the information has been completely entered into the APCHO's enrollment tool, and this box here would just be confirming the information that has been entered. And after this particular window, you're actually transferred from APCHO's tool directly to the state registrar's website. You can go ahead and do that now.
Jeff,
yeah,
you need to let them know that that's only in 3 states, right? That's on. This is when you put in California, it says this says that you're eligible to do this. It's all this will also pop up in Nevada and in Washington State, but that won't pop up in states where they can't transfer you directly to your Secretary of State's online site to register.
Correct. Actually, yeah, thank you for noting that, Mark. So there are a limited number of states that have state online registration tools available. And in those states that do have that as an option, all of this information that you've entered on APCHO's site is actually auto-populated on those respective sites, on those respective states' registration sites. But if you're not in one of those states, what the option that you have here in this window is that, and it's also an option in these states as well, if you don't wish to enter this information to the state registrar's offices, is that the fine print underneath the box, Beverly, indicates that you can print from this position itself. So what I wanted to note again is that the information that's entered is entered automatically into the state site, which all you then have to do is to validate the information that's been entered and push submit, and the information will be submitted formally to the state registrar site. Now, for those of you who are not in states with online registration, the forms that the information that you have completed will be printed out at the end of this process, and the client has to then sign that form to finalize the agreement, since there is not an online enrollment process in your particular state. Mark has been working with a number of health centers in these particular states, and my understanding from that, and feel free to jump in, Mark, is that it's really important for states in such states to establish local practices in your health center, so that it is important that everybody knows that they, as an example, should submit all of the forms in the different sites that are collecting and registering folks into and submit them to one person on Thursday of each week, so that someone from the office can drop off those forms at the local registrar's office on Friday. Mark, do you want to speak a little bit more about why that is considered a best practice in your experience?
Sure. Well, again, kind of just like, well, one thing I would say is if you're going to be doing this, you always want to check with your local registrar so that they know you are. And you always want to have some paper forms on hand just in case there's a computer problem or people don't want to use a computer. But the main thing is, just like you don't want the person to take their form and go mail it in, you don't want to collect, 100 forms at various places or various sites and then not have a system for making sure they get submitted. It is actually a violation of the law to collect registration forms and not submit them in a timely manner. In most states, it's 10 days, within 10 days, or before the deadline for the election. So a best practice is, right, to get these forms from all your sites into one place and then have one person be responsible for taking them to the registrar, or at the very least have one person at each site. If your sites are widely spread out, then you want one person at each site to take it to the local registrar and turn them in physically rather than mailing them in. I think you could mail them in, but quite honestly, unless you have more faith in the Postal Service than I do, you don't want to send something in that has a deadline to be received and not know that it got there. So it's just always a best practice when you're doing voter registration and you're collecting the forms from folks to know that they got turned in. So that's why.
Thank you, Mark. And that was really the end of the walkthrough. As you can see, it's a fairly simple and direct process. Again, I just want to emphasize it takes about 2 or 3 minutes. I can't attest to actually walking through it in the other languages since I cannot understand the other languages, but I've been through quite a few of the different scenarios in the English version, and it does, and I've been able to validate that all the information that has been entered exists in our database. I just wanted to just clarify for folks again the reason that there is this voter registration tool that exists, and it's really intended to standardize and facilitate the collection of the information for the people that we want to be able to follow up and provide ongoing outreach and education to. The collection of this information and its management it's going to be integrated into another tool that APCHO is providing as a new benefit to its members, and we are currently calling it our grassroots advocacy management tool for our members. And this will allow our members to participate in reaching out to those newly registered or updated voters, folks that they were engaged in, and send them reminders about the election, where they're to help send them to help them find their polling places and send them to information or resources related to the issues at their local elections. But I also wanted to just clarify to folks who are participating in this program for APCHO, there are many things that can be prioritized this coming calendar year. And this activity, the civic engagement activity, for some of you who are hearing this for the first time, is much more than, again, a voter registration drive. Our intention at the end of this first year of this project, and this is a project that APCHO is, at least for now, considering as a 3-year project, is at the end of its first year, we hope to have a list of the newly registered and updated voters at each of the participating health centers so that we can help the health center conduct a voter turnout of the folks that are in their community, as well as to help our members identify promising practices in the civic engagement process. That could mean various scripts that have been used to help engage and secure a yes on the registration tools that are used, partnerships that work in helping people get out to vote, and protocols that health centers put into place. These are just some of the examples that we hope to help other health centers capture this after this first year, so that they can help in implementing improvements moving forward in year 2 and year 3. Because we certainly want to be able to help all of those health centers who are committed to this effort improve their capacity to do so. So
Jeff,
those are my, yes, Mark?
Yeah, there were just a couple of things I wanted to say. One is everybody on this call and anybody that you're going to have doing this should really go through the tool themselves. You can go through the entire process and even submit it. If you don't have online registration or connected to online registration, you still have to print out the form. If you don't mail it in, you won't be registered. But it is okay to register to vote more than once. If you want to try it out and you want to go all the way through the process in a state where you can do that, you can. It's not against the law. The registrar will use the last registration. It's against the law to vote twice. It's not against the law to register twice. And even if a client says to you, well, I don't know if I'm registered or not, you can say, well, why don't we go ahead and make sure, and we'll get you registered, and that won't be a problem. So that's the first thing. The second thing is I just want to make sure, because nobody's asked questions yet, that people know that the data that's being collected will not be kept in a form, nor will it be made public in any form that connects the clients to the health center. So as long as that is the way it's going to be handled, there is no issue around HIPAA or disclosing the patient's status as a patient of the health center. So I think it's important to know that, because some people get a little nervous, but just those two things are things I want to make sure people knew that, and certainly if you can't use this to register somebody to vote, I don't believe, if you haven't walked through it yourself, so that you kind of see how it works. And you can walk through it in language, or you can walk through it in English. But I really recommend that anybody on this call, but certainly anybody that you're going to have actually using this as part of the enrollment process or any place else, should use it, should walk through it. And you can do you can do this again in a lot of different ways, but there shouldn't be any surprises. So I just wanted to make sure that was clear.
Thank you, Mark.
Thank you, Mark. Thank you, Jeff. We are now going to begin the Q&A portion of our webinar. So to participate, you can click the blue raise hand button on the control panel on your screen. Alternatively, you may also submit questions in writing by typing them in the questions field. And our first question is, and Mark, this is directed to you, how can we learn more about integrating nonpartisanship into our approach? And the person asking that question has said there seems to be just a lot of room for, there's a lot of gray area there.
Well, there's actually not so much gray area, but on our Community Health Vote website, there's some information about that. But I don't know that this was said up front, but APCHO has hired me as a consultant to help with this, and I am glad to work with you at your health center or to address any specific questions about that. I think it's important to understand that a lot of people think that there's a perception that health centers, if they do voter registration, will only be registering Democrats. We have no way of knowing that, and the fact is that if you offer registration to everybody who comes in, it's perfectly legal and it's nonpartisan. You can't, and again, this is part of training, you can't have anybody registering voters wearing a campaign button or a campaign t-shirt. They have to be trained so that if the question comes up on the form, do you want to choose a political party, and the client says, well, I don't know which party should I pick? The response is, I can't make that decision for you. If you don't know which one, why don't we click none? Right? I think those are fairly basic training questions that people want to go through, so that the rule of thumb is any question or any statement that has implications for making a recommendation about one candidate or one party, the answer has to be, I can't help you with that. You know, who should I vote for? I can't help you with that. Which party should I register as? I can't help you with that. You need to decide for yourself if you don't know. One of the questions that comes up, and really it comes up sort of now before the election, is somebody wants to know, I don't know anything about the candidates. How can I find out about the candidates, or which one? You know, basically, I think another good practice is to be working with local organizations and partners so that you kind of have a handout you can give people that says, you know, if you want to know more about the candidates or about the election or about the ballot measures, here's where you can go for more information. That's the best way to avoid any hint of partisanship. That, and make sure you're doing this all the time, right, rather than just right before an election. So I don't know if that, and again, I'm available to answer more specific questions if needed.
Okay, and our second question is, when we conducted voter registration drives, we inputted individuals' information into a database. Are we allowed to contact them for follow-up on voting, even though we didn't ask permission to contact them?
Well, folks should know that once you register to vote, your information in the voter file is public. So that actually, once you register to vote, anybody can contact you about the elections. So the answer to that question is yes, you can. Now, again, if you're going to call them from your health center, you know, that's fine. You can say something like, you know, I'm calling you because we here at the health center, you know, we're calling from the Charles B. Wang Health Center, and we want to try to make sure everybody goes out to vote because we think it's really important. You shouldn't mail them anything that identifies them as a patient of the health center, and you shouldn't do anything, give their information to a partner to call that identifies them as a patient of a health center. That's kind of the things you have to be careful of. But if you are registering people at events, and you are registering anybody who comes into the health center, whether they are a client of the health center or not, it really makes the HIPAA issue kind of moot, because if you contact everybody that you registered, and you registered people who weren't patients of the health center, then you don't have a problem. So the brief answer to that question, now that I've blown all that smoke, is yes, you can contact them about going out to vote.
Okay, thank you, Mark. We have no more questions. I think Jeff wants to say something.
Yeah, Mark, I have one more question that I heard from another health center, and I think I've heard you comment on this before, but I think it needs to be shared with everybody. Another health center has previously done voter registration drives, and they receive some auto-numbered voter registration forms from the state registrars. Are these forms, can you speak to these forms and potential problems with HIPAA?
Yeah, this was an issue that came up in California. I don't know whether it's an issue in other places, but if you go to your local registrar in some states and you ask for paper forms, what they do is they give you paper forms, and they're numbered, right, sequentially numbered. So say they would give the Charles B. Wang Health Center 100 forms numbered from 100 to 201. And so you give them to the patients fill them out, and then you turn them back in to the registrar. Well, the fact is that somebody at the registrar's office could look at those forms and say, oh, this person filled out registration form 207 or 107, so it came from the Charles B. Wang Health Center. Technically, that's a violation, or could be a violation of HIPAA. So basically, if your registrar wants you to use forms like that as sequentially numbered, one of two things has to happen. One is you have to be using them, like I said before, to register people other than patients at public events or other activities, or anybody who walks to the health center, so that there's a plausible argument that not all of those people who were registered were actually patients of the health center, and so that number is irrelevant from that standpoint. Or you have to basically say you're not going to use those forms, and you can use the federal form, and that's what's actually printed out on the online site. If you use the online site that Rock the Vote has, and you go to the end and you print out the form for the patient to sign, it is actually the federal voter registration form. Every state has to accept it. but so it doesn't have that problem. But you'd have to try to use paper forms that did not have that identifier on it, just to be sure. Now, again, I'm not aware that anybody's ever run into a problem with this, but when it was presented to me, I asked the lawyers, and the lawyers said it could be problematic.
Okay, Mark, and we have one last question, and that is, are we allowed to adapt community health votes materials and resources like the stickers and buttons that say I support community health centers and I vote into different languages?
Absolutely. There's no trademark on those. They were produced for, as templates for people to use. We and our partners at Nonprofit Vote have produced them in English and in Spanish, but clearly we don't have the capacity to produce them in languages other than that. You should feel free. And in fact, we were just at NIMS in San Francisco, and they produced some really nice posters that said ask about register to vote or register to vote here, and they put it in several languages. You should feel absolutely free, and I think down the road APCHO will be working with folks to produce some other stuff in language, but any of the materials that we have available you should be able to download and use however you choose.
Yeah, and this is Jeff, and under that spirit, really, we hope to be able to share on our website, if you're willing to share it with us, any of these adapted, translated materials, so that not every health center has to go through the effort themselves. So after this call, I believe Beverly will be able to send you more information about the location on APCHO's webpage, where many of the civic engagement resources are available. And that's really in addition to the Community Health Vote website that Mark already maintains as well. So again, thank you, Mark, for your comments.
Okay, and if we were not able to get to your question today, we want to ask you to please feel free to send that question in, or if you need additional information, you can contact us as well. The email address would be civic-engagement@apcho.org. And you can also find more information on our website at www.apcho.org. Lastly, I'd like to thank Mark for helping us pull this webinar together on quick turnaround. Thank you to Jeff for your presentation. And thanks to all of you for participating today. Please keep an eye out for an email from us, which will include the materials from today's webinar. Thank you all again. Hope you have a great day.